I am Dr. Vijay Kumar Sohanlal, Senior Orthopedic Consultant at MGM Healthcare and Mahi Clinic.
எங்களுக்கு முட்டி வலிக்காக இந்த ஹாஸ்பிட்டலுக்கு வந்திருக்கிறோம். நாங்கள் எம்ஜிஎம் ஹாஸ்பிட்டல் முன்ன கம்மியாக இருந்துச்சு, இப்போ ஒரு மாதமாக கொஞ்சம் ஜாஸ்தி இருக்குது. அதுக்கு ஆப்ரேஷனுக்கு வந்திருக்கிறோம்.
I have a very strong and highly motivated 84 years old lady who came to me with a severe pain in both her knees for last 40 years. Her pain got aggravated since 1 month and she was unable to stand and walk. When I saw her, she asked me one question, that whether I'll be able to make her stand and walk again or not. When I examined her and when I saw her x-rays, I thought she would only benefit with both knee replacement. But the challenges were her age, osteoporosis, both the knees were completely bent like U-shaped, almost 30 degree of genuvarum and fixed flexion deformity, and whether she'll be fit for the surgery or not. And if she's fit, whether we should do both the knees at single setting or one knee at one time. I asked her to undergo a pre-anesthesia checkup and cardiac opinion as she had some cardiac ailments. Unfortunately, she turned out positive for COVID-19 RT-PCR, and as a result, we cancelled the surgery and asked her to get treated for COVID. All these days I was just thinking that she should recover from this COVID, because we all know how second wave of COVID is, how dangerous it is. And I was thinking that she would never come back asking for a knee replacement again to me. But I was wrong. After 1 month she came back and asked whether I can operate her or not. We planned her surgery and she got admitted with high risk consent. The plan was to do both the knee replacement at single sitting, depending upon how she behaves inside the theatre. If not, then do only left side and then wait and then do right knee later on. Inside the OT, there were almost 100 implants were ready with the primary knee, stem for tibia and femur, augments, TC3, constraint, implants, and as well as sleeves. By God's grace, the surgery went on well. She did well inside the OT, and I could do both the knees at single time. Both the knees were replaced. She didn't even require any CCU care, considering the fact that she had some cardiac ailments. First post-operative day, I made her stand with the help of a walker, and since second day from the date of surgery, she started walking.
40 साल से वो दुखता था, इधर आई, वो विजय कुमार है, वो क्यों अच्छा है, ऑपरेशन करना है, मैं ऑपरेशन करा दिया, अच्छा हो गया, चालने से आ गया, अच्छा हॉस्पिटल अच्छी है,
डॉक्टर नर्सेस की यहाँ सपोर्ट कर रहे हैं।
विजय कुमार अच्छा है, वो हमारा हावड़ कर दिया पग, सीधा नहीं होता पाँव, अभी सीधा होएगा, अच्छा चली जाए, अच्छा हुआ है।
She has been discharged successfully and she is doing good. Thank you very much.